Hey guys, this is Alyssa, and this is my response to P2 Discussion 6. After reading the prompt, what immediate problems should the crew suspect with this patient? Some immediate problems to expect with this patient would include potential traumatic brain injury, increased intracranial pressure, hypovolemic shock due to suspected internal bleeding if no external hemorrhage is found, multi-system trauma, and respiratory failure. I'm sure there's more, but those are the things I caught off right off the bat. The reasons I would suspect a traumatic brain injury is because of the injuries we can see on the patient and the mechanism of injury. His airway was obstructed with blood and teeth, and he had a laceration on his forehead, and he was ejected from the vehicle. These injuries and mechanism of injury indicate that he hit his head and face on something with significant force. Since we can see injuries on the outside of the head, there are likely injuries inside of his head, especially to the brain and cervical spine. Remember, there are multiple collisions involved in a wreck. One of those collisions is the internal organs hitting the skeleton. He would have also suffered an additional collision of hitting something outside of the car since he was ejected. The brain could have hit the skull with a lot of force, which could explain the abnormally high respirations and unconsciousness. These symptoms would also cause me to suspect increased intracranial pressure. If there's swelling to the brain or brain bleeds, then this can cause increased pressure in the skull. The increased pressure and mechanism of injury could have damaged the brainstem, which would explain why the patient's breathing is so rapid and labored. I would also be suspicious of hypovolemic shock because this patient is exhibiting all the classic signs of shock. There is no radial pulse, although a carotid pulse is present. There's delayed capillary refill of 4 seconds, pale, cool, and diaphoretic skin, and tachycardia. These are all signs that his body is not perfusing well, and compensatory mechanisms are trying to fix this. If the airway was not secured and taken over by the paramedic, then the patient could have definitely gone into respiratory failure. I would also suspect multi-system trauma due to the report of the car going through the guardrail and the patient being ejected from the vehicle. Number 2, what should their next actions be? Since they have already assessed airway, breathing, and circulation, their next actions should follow a standard rapid trauma assessment. They should also call for additional emergency personnel to come to the scene to help with the patient care during transport. A rapid body sweep should be performed to make sure the patient isn't significantly bleeding from anywhere or have any immediate life-threatening injuries. On-scene time should be minimized since this patient needs interventions that can only be accomplished by scans and surgery. In the ambulance en route, if the paramedic was able to acquire additional help, they should continue ventilating the patient. Hopefully, securing the airway meant that they intubated the patient and are now controlling ventilations with the BVM, and attempt to start a large bore IV or IO to begin fluid resuscitation. The patient should be reassessed every 5 minutes, and a trauma activation should be made along with the radio report to the hospital. They should also be careful of any interventions so they don't worsen the potential increased intracranial pressure. Overall, this should be a load and go with airway control, shock management, and rapid transport to definitive care.